So testing is such a hot topic right now because I'm sure, heard throughout the news that we don't have enough test kits. We don't have enough test kits. What are these test kits? Well, let's kind of break this down. So I have the wonderful ability that I am a medical laboratory science. I went to school for that. So I, in my training, learn about different ways that we at the hospital test people who come in sick for potential diseases. So most respiratory diseases are tested through mucosal secretions. So mucosal secretions are things in our lungs, our throat, our nose, our back of the throat, and our mouth. And so for the coronavirus particularly, what we did in the beginning is we took a swab and stuck it in our nose, well, not our nose, but the patient's nose, all the way back so it's touching the back of the throat. Kept it in there, swirled it around a little bit, and pulled it out. And so we had a nice mucosal secretion that can be tested. Now, there's multiple ways that these specimens are being collected. There is no one way to do it, but mind you, there are guidelines that are set out by facilities that show appropriate specimen collecting. So just because somebody goes get a nose swab doesn't mean that that is going to be your case if you happen to go get tested for COVID-19. So once they collected the specimen, it gets packaged appropriately, sent to a testing facility, and they do a procedure called PCR, or polymerase chain reaction. And in simplistic terms, because I could go on for hours about PCR, we are looking for a particular code. And this code says, you have coronavirus. And if you're positive, then we reach out to you, or your health provider reaches out to you and then starts planning next steps. So there are the three stapled items: the shortness of breath, the high fever, and a dry cough. And so some individuals might be presenting that. There's other researchers that are finding that people might not have any symptoms at all, or could have a very mild symptoms. Researchers have seen that you go in phases where you start with these three determining factors, and then you go to like a flu-like phase, and then you go to a pneumonic phase, which means there's fluid building up in your lungs. So coronavirus doesn't have a specific image. It can be very different from person to person. I mean, there are some researchers that have been seeing that patients have diarrheal symptoms. It's really dependent upon how your body is fighting off that infection. But in order to know if you have coronavirus, if you have those three symptoms that I talked about in the beginning, contact your health provider. They might ask you to come in to get tested for it, or whatever they deem appropriate, and that's the only way to know whether or not you have coronavirus, is if you've gotten tested for it. Mind you, there are some risk factors if you traveled in an area that has had a high caseload of coronaviruses, if you are working in a health facility where you're working with COVID-19 patients, to even having a potential interaction. So it's important to understand to minimize the risks associated. Stay at home, stay safe, clean, just follow those guidelines that we've been talking over and over again in these videos. So another question is, how do I manage my time during quarantine? Well, that really depends on you. There's no correct way of handling quarantine. Everybody handles it differently. I know myself personally, I've been reading all the books that I haven't had a chance to. I started learning how to knit and start cooking new and exciting things. Just little things a day that is new and exciting to keep me focused and ready for a productive day. I know that some of you are probably staying at home due to the environment around because you can't be exposed to other individuals. There's a variety of reasons, but if I could give some advice, the best thing to do is create a schedule for the day. Coronavirus is disrupting everybody's schedule, and sometimes that can put us in a tailspin. So just sitting down for 15 minutes a day and writing out a list of things you want to do today and sticking to that list can help you center into an appropriate routine to keep you up and going. Also, it's really important to utilize exercise, going outside, feeling the fresh air. Don't just stay cooped up inside. To really combat the quarantine blues is to be proactive in your life. Another thing is call your loved ones, call your friends, call your mom, call your dad, call your brother, call your sister, call somebody at least once a day, or talk to somebody. Have those conversations. Start an open dialogue about COVID-19. I mean, you don't even have to talk about COVID-19. You could ask, how was your day? You could talk about the weather or a particular thing you saw on television. Just talking to one individual a day can kind of help center ourselves in this crazy world that's going on. Are there any resources that I can be looking out to help me stay informed? Absolutely. There's a ton of resources out there. Your best bet is to always go to the Centers of Disease Control website, the World Health Organization website. They have amazing information to help you stay up to date about COVID-19. We are fortunate enough to be passing out care packages to individuals here in the Flint community. Those care packages are going to have information for you to use to help you understand about COVID-19, some of the resources and facilities out there, numbers for mental health providers if you're experiencing anxiety and depression around the change of pace. There's so many things out there. And, it takes you to make that step to find that information. And so, even with this video series, we're going to cover a lot of information to help you stay informed. And as always, you can email us. Our email is listed below to help you answer some of those questions. And if we can't, we'll find the right people that can help answer those questions for you. And so, one last question. So the last question is basically, what is your project? How are you helping people affected by COVID-19? So, as I talked about in the first video, we are a community-based project working with the Flint Development Center. This tiny project to help get resources out to the community. There's a lot of questions, there's a lot of concerns, there's a lot of things that are going on that we don't know answers to. But to kind of alleviate some of that pressure, we want to provide you with information we do know. COVID-19 is changing every single day. We're learning new and exciting things about the virus to help get vaccines out there, to help minimize the spread, to even ways that we are handling at the hospital. Every day is a new day. And so the more information we can get out to you, the more safe and insured you can feel. And as always, we have resources linked in our description of these videos that you can link to look at a brochure that talks about ways to stay healthy and clean during COVID-19, to outside sources that talk a little bit more about the virus. There are many things out there. We just want you to have the ability to access those things. So we talked about a lot of things today. A lot of questions were addressed. But as always, we want to thank our amazing community partner at the Flint Development Center. We'd also like to thank our sponsors at the University of Michigan Flint's Truth in Action Partnership Project, coordinated through the Office of University Outreach, with funding provided by the W.K. Kellogg Foundation. COVID-19 is a very scary time, and there's a lot of uncertainty, but we and our community partners want you to feel safe. We want you to have information at your fingertips, and we want you to stay healthy during this COVID-19 pandemic. So stay safe out there, Flint.